we're tired, we are, traumatized, and, we don't want to see patients dying. We're in the business of saving lives. I love the beach, so I'm looking forward to just laying on the beach and just let time pass, just to relax and reflect. A lot has happened over the past 18 months, and I haven't stopped to really process it and, just reflect on what has happened, allow myself to feel and go through the emotions of the last 18 months. So I'm looking forward to just relax and just let time pass. It's been tough. Luckily, I found out over the past 18 months I'm more resilient than I think I am, because it's been really, really tough to deal with your own personal loss from people around you that you work with, their families, just having to support them through this difficult ordeal, having to be strong for them. As the leader, they're looking up to you for strength. But I've also been able to show my vulnerability, which I think is a very important aspect of being a leader.
And how have you dealt with the emotional toll of maybe multiple patients dying from COVID on one shift? That was,
and still continues to be, because we still have patients dying, not to the extent of what it was back in 2020, March, April, and May. But every death is still takes a toll on you, especially from something that can be prevented. But there's one day in particular when I went down to collect personal protective equipment for my staff. And when I saw the trucks lined up that were the morgues, because we had run out of space in our morgue, we were now putting them in freezer trucks, bodies in freezer trucks. I just broke down. I really just broke down, because it really hit me that day, the magnitude of what we're dealing with, this overwhelming loss and death. People were dying alone because their families couldn't come. And as much as my nurses, made a pledge that no patient would die alone, they wanted to hold hands and, FaceTime families to say goodbye. The number of deaths that were happening, sometimes it was impossible to hold everyone's hand and to, FaceTime so a family member could say goodbye, or to whisper in somebody's ear that a message from a husband, a wife, a mother, a father, to say, tell my loved one I love them. So at the peak of the pandemic, there were 16-hour days, 7 days a week. I don't know how I did it. Some days I don't remember the drive home. And there were days, mornings, many mornings, where I would look in the mirror, the full-length mirror, last thing, before I go down the stairs, and I'd say, I felt like I was going to war and didn't know if I was coming back home. I remember one day coming home after, it was about the 13th or so hour, where the volume was just increasing and I had to open up yet another ICU space. And when I walked up to the 6th floor and got on the landing, my legs just couldn't move anymore. I was hot. I felt like I was so weak. And one of my nurse managers said, Sandra, you have to go home. And I said, I can't go home. We have this other ICU to open. We have patients coming in. And he said, we can manage. This is not our first ICU now. We're going to expand. You have to go home. You don't look good. And at that day, I thought I was getting sick. I don't remember the ride home. I went home, drank my tea. I always have some white rum at home. So I took a shower, rub up with my white rum, and I was afraid to close my eyes. That's the first time in my life, and I'm a sleeper, that I was afraid to close my eyes. And I said a prayer and I said, God, please don't let me die in here alone. And I closed my eyes and woke up feeling refreshed. I didn't have COVID. Exhaustion. And that's what many healthcare workers are going through every single day. Exhaustion. We're out there caring for, and I'm speaking to my fellow Jamaicans now, your loved ones. We have to then go home to our families. I have nurses who left home for months because they were afraid to bring COVID home to their parents, to their children. So this is what we're dealing with, and it can be prevented.
The Delta variant now makes up about 83% of all the COVID strains in New York at this time. Has that changed the situation in the hospital you manage?
So we are monitoring. We started to see, prior to me leaving, a small uptick, but we're closely monitoring. We see the variant running rampant and see more cases in areas where vaccination rates are very low. And that should tell us something. In New York, we have a higher vaccination rate, so prior to me leaving, we haven't seen that uptick yet compared to some of the states where the vaccination rates are lower. Because that's where what the variant likes, that's how it replicates. With lower vaccination rates, it has room to replicate. With higher vaccination rates, you don't have the virus doesn't have much room to replicate, and hence the importance of getting our population vaccinated. But we are monitoring, we're sitting on edge because we don't want to go back through what we've been through. We're tired, we are, traumatized, and, we don't want to see patients dying. We're in the business of saving lives.
What infection prevention measures do you believe should remain in effect post-COVID?
Definitely hand hygiene. You can't emphasize enough the importance of hand hygiene. We carry a lot of germs in our hands that we can pass on person to person. I see masks being around for a while. Even if it's not mandated, I think people are just going to want to protect themselves. And actually, I was saying to a friend in my previous travels, there are some people, when you go on vacation and see them, they always have their masks. Just pre-COVID, they always have a mask, particularly Asians. I plan to have mine for I'm vaccinated, but depending on what the CDC, what the evidence shows, because I am into the science. My profession as a nurse is rooted in the science. So I go by data, and the data doesn't lie. So whatever the data shows, if you're going to a particular place, it's recommended that you wear your mask. If you're going into areas where vaccination rates are lower, it's recommended that you wear your mask. But for sure, hand hygiene, we should definitely continue to promote post-COVID. A personal message to my fellow Jamaicans. I was the first American to be vaccinated almost 8 months ago, and I am doing well. Here I am in Jamaica. I couldn't wait for this day. I prayed that my life would be spared so that I could come back home. As you can see, without action, this virus is going nowhere. But we have the power to win. The power is in our arms. So please do not listen to propaganda on social media. Follow the science and the evidence. If you have questions, speak to a trusted expert, not your friends on the corner, not social media, not people who want to divide us. Everywhere I've traveled around the world, everyone is fascinated when they hear that you're from Jamaica. Everybody wants to be Jamaican. Everybody wants to speak our language. Everyone wants to come here. We won't have a Jamaica without the people. It's the people that make Jamaica. So let's just work together, teamwork, and preserve our little island of Jamaica. One love.